All right. So good afternoon, Commissioner. Today is Sunday, May 17th.
Crazy, right? We've been at this since the first week of March.
Yeah. I was actually thinking today it's what we're well now over 2 months in our the significant way all of what's happening in our communities has impacted us. And I think that's really the main theme of your weekly message this week in this video, is really to talk about resuming full operations and the planning that the department has undergone. So we'd like to hear from that.
Yeah, so our Solent North and South, as well as the Caroline, have remained fully operational over the last 2 months. I just can't thank them enough. We saw some appreciation in the Middletown Press this week by a recognition of just the staff and their dedication on the South Campus, from the Middletown community, with firefighters and law enforcement and the CVH police, who kind of drove through with their lights and sirens blaring. And they were welcomed by a thank you message of chalk art from the kids and staff at Solent South. So it was a really nice display of that kind of mutual appreciation for the essential workers that have worked through this crisis time period. But along with the direct services to kids and youth, we know that May 20th, the state itself is starting to reopen. This decision has been met with both excitement and concern. People are still worried. The question many of you have, though, centers around, what does that mean for DCF? What's next for us? Our weekly message today will start to focus on, how we start to move back towards full operations in our regions and central office.
And there's been a number of activities that have gone on. The creation of 4 subcommittees. We are now in the process of asking our partners at the Statewide Advisory Council, through Favor, AFCAMP, and our Family First Work Group members to, really provide us their insights into what resuming full operations would look like. And I know there's even a separate group that's going to be looking at our private providers and those we contract with.
Yeah, so let me confirm that we have no specific time frame for when this resuming full functioning will occur. And, a lot of this planning is to help us gear up for what that looks like, because we kind of just moved into this 85% of us in this telework environment pretty quickly. We may not have been completely prepared as a state, but, I do think DCF has fared well at moving us into a virtual environment pretty fast. We just now have an opportunity to think about what it's going to look like in reverse, in anticipation of, how do you stand things back up that have been kind of put on hold for the last 2 months. I know, staff are getting anxious and getting worried about the kids and families that we serve, because it's really hard to maintain good engagement and solid connections in a virtual world, but people have been doing remarkably well at that. So, a couple of things that we have done to start moving us in that direction. Nothing will drastically look different on May 20th for DCF, but we have already, as you indicated, start centering some subcommittees around specific aspects of our work. We have 4 basic kind of buckets, and that's the physical safety question, emotional and psychological safety, health and medical as the 3rd, and then personnel considerations as the 4th, of the kind of categories that we have focused our attention around. Thank you so much to all of the staff who have dropped a note into our COVID mailbox. I think, Ken, you said something like over 100 responses that we've gotten from staff across the department and different disciplines to help kind of inform some of the work of those subcommittees.
Absolutely. And, Commissioner, I have been looking at those emails as they come in and making sure that the appropriate committees receive that information. And I think I've told you this before, but I think it's really important for staff across the state to hear the message too, that the feedback we've received has just been tremendous, both in talking about what is working, what could be improved upon, but then also offering us solutions, how to resolve the problems, not just calling it out, but saying, if we had X, Y, and Z, or if we could consider the work in a little bit different fashion, we think it would be even more efficient. So we want to keep those responses coming in. In fact, I was checking that mailbox over the weekend, and I think we've probably had 20 additional people since the last
That's
time we
great.
talked. So
That's
let's keep
great.
that information coming in. Absolutely.
Mm-hmm. So, also one of the things that you'll see this week that's just a tad different within DCF is that if you recall, we closed the 5 offices that bordered New York because you remember that New York was a considerable hotspot there for a while. So we closed those offices altogether, and now we have spent the last week kind of just bringing them back online. Circulating the air, circulating the water, doing some additional cleaning in those offices, and making them kind of up to par with the 9 other offices that have remained open. That just means that this week we will be able to allow staff to go in there if they'd like to kind of pick up things, or the staff who have been doing some work sporadically there on a rotational basis, but really start to unpack what it will look like to have those offices resume, where the other 9 have been over the last couple of weeks. So that's exciting to be able to see that happen.
Sure, sure. And as all this is going on, we also want to keep in mind that May signifies 2 very important acknowledgments in our work. It's National Foster Care Appreciation Month, and this week we're going to have our next Spotlight on What's Right newsletter coming out, hopefully on Wednesday, which highlights the great work our FASU staff are doing across the state, highlighting some of our work and our therapeutic foster care providers, as well as KFAF. And we also know that it is National Mental Health Awareness Month.
Yeah.
And talk a little bit about that.
So we continue to see lots of great things happening in our foster care divisions related to acknowledging and appreciating the at-home heroes, is what we've been calling our foster parents, and the additional responsibilities that they've had to take on over this time. But we also recognize in Mental Health Awareness Month that these are challenging times. We've grown as an agency. We've learned so much about each other and about our work. I'm continuing to feel completely blown away by just the amount of camaraderie that I see out there. I'm not surprised, though, because that's the DCF that I know, that over the last year, we have been trying to lift up, to let people know that, we are an agency that sticks together, that really, considers ourselves one big extended family, and all of the, nuances that takes on. So, along with what we've learned about each other, we learn, how we can practice our work in the years to come. We've been challenged both professionally and personally. And, in Mental Health Awareness Month, it's an opportunity to say that asking for help is a sign of strength. It's a sign of resilience. It's a recognition that self-care is important, and that mental health care is just as important as the public health considerations and the physical health considerations that we have. So, I encourage all of our staff to take a look at some of the resources and links that we'll provide this week in acknowledgement of Mental Health Awareness Month, and to, pay attention and care about the wellness of, yourself and those around you. Before we get into the data of this week, I do want to share a quote that I read to our senior administrators that I think personifies the state that we're in right now. And it basically says, it's a quote by Roy T. Bennett, and it says that the comfort zone is a psychological state in which one feels familiar, safe, and at ease, and even secure. If you're always doing what's easy and choose the path of least resistance, you're never going to step outside of that comfort zone. Great things don't come from comfort zones. And I think this pandemic has put us in a place to really be a little unsteady on our feet and, not really sure what's around the next corner. But because we are a strong department, because we are a department that takes care of not only the kids and families that we serve, we take care of each other. And, we're in this together, and I walk right alongside you in this journey as we acknowledge the uncertainty of our future that impacts our personal and professional comfort. And I encourage us all to embrace the challenges and growth of a new way of operating this agency, sometimes outside of our comfort zone. So let's move into the data and statistics this week as we wrap up our video. So as of today, May 17th, Again, the Connecticut itself is up over the 37,000 COVID positive cases, Ken. Those are Connecticut lab confirmed cases. We've had 32 staff members who have tested positive across all areas and divisions. We've had 27 of those return back to work. So, that's encouraging. Some of those trend lines are moving in the right direction, but, they don't erase some of the losses that our communities and our staff have experienced, though, right? We've seen increases in COVID test sites. You're going to start to hear of increased capacity to test our congregate care staff and kids, and also, some even asymptomatic front-facing staff. You're going to hear a lot more about that this week as we look to try to identify how we can, see where any potential hotspots of transmission could be in the state and plan around that. We are up to 55 foster parents, which 31 core homes and 24 TFC foster parents who have tested positive. We've had, 2 foster parent deaths to date, and we are holding steady at 8 kids or 8 youth that are in our care. I also want to add that because of the syndrome that seems to be impacting young people, that our medical division headed by Dr. Taylor is taking a closer look at kids that have had any type of symptoms or symptomology for a little bit longer than they typically were going to, just to make sure that we have a handle on anything that could start to look like some of this new pediatric findings. But so far, none of that has impacted the kids that we have in care. And I think that's about it for statistics this week. Anything more, Ken, that you can think we need to add?
No, I think it was really important that we did really review the steps the department has taken regarding the resuming of fall operations at some point, and to really clarify with staff. There is no date that we have for that. We are going to have a reopening of certain parts of the state this week. And the feedback that I've been hearing is that, certainly staff want some more concrete answers about what's going to happen to us. And even though we want to give a lot of those answers, they will be delivered with it at the right time when the correct information is known.
That's right. That's right. Yeah, that's why it's important for people, if you know that there are staff members that haven't been watching these videos or paying attention to the information that we've been putting out, now is the time for them to kind of get caught up, because we share a lot of information this way. We share information in our memos, and it's important for people to feel confident in the planning that we're doing, because if you believe that we're flipping the switch, sadly mistaken.
And we are bringing in, again, our partners, statewide advisory council, favor, contract providers, and other groups.
And I'm also facilitating a dialogue between other health and human service state agencies, because we know that some of us share space, but that we also share common things such as transportation, visitation. Look more for the triage process to be expanded to helping us understand what visitation will look like between kids and their parents beyond what's happening in the virtual environment. So lots of moving parts, but we're right on top of it, and we're looking to you to give us more guidance through the COVID mailbox and through your chains of command and through just every part of the department rolling up their sleeves to try to figure out how we're going to get through this.
Absolutely. So we look forward to having a great week, a busy week, but lots of planning, lots of collaboration across the state. That's
right. So have a good week, everyone. Again, very proud to be your leader and very proud to kind of help us get through this together.
Got it. Take care.
See ya.